Okay, good morning. How's the sound? Everybody can hear me back there? Hi, wave. Okay, well, thank you all for being here today. We're really excited to really kick things off on a major initiative on campus, along with a lot of our partners from the foundation as well as our Med Center. And so today we have a great agenda set up, so we can introduce the project, let folks know and hear right from our CFOs what the vision is for this project to replace our financial system, and get a chance to meet the team that will be putting everything in place. So to start off, my name is Kevin Chow. I work in IT services. My role on the financial project is really support. I'm the director of the Enterprise Systems Renewal program, and our FIS project is one of the crown jewels of our major initiative. And so I wanted to thank everyone for being here and to really do the welcome. We're going to start off today with a video. It's really short, 2 minutes, and we will then dive in on the highest level with introducing our two CFOs, Pierre Houillet and Laurie Donaldson, to basically give us the vision and how we're going to go ahead and launch. And without further ado, let's go ahead and get started.
The Enterprise Systems Renewal program is a UC San Diego-wide initiative to upgrade our outdated business systems and streamline our business processes. The program includes all critical campus systems which support finance, research, student, and payroll. Subject matter experts, managers, and staff from across campus and UC Health will ensure the new systems meet business needs and grow with our expanding campus community.
For the first time ever, the health system and the campus will share a common chart of accounts on a shared general ledger system. We will have a truly integrated financial system that will eliminate the need for shadow and subsidiary systems and many manual processes. The automation that this new system will bring will drive more efficiency into our health system and provide real-time information that's necessary to manage a complex healthcare system such as ours.
So we're targeting July 2020 to replace our outdated financial systems with new, more flexible and modern technology that's cloud-based. But it's not just about technology for me. It's about rethinking everything we do, challenging how we do things, streamline, simplify, better meet the needs of our community wherever they are. And that's really what ESR is for me.
We're going to break everything related to our legacy financial processes and systems. But we'll have an opportunity to think about our business in new ways. These new ways offer us the chance to leave lots of overhead behind that we were forced to use because of the limitations of our old systems or our unique ways of doing business in a customized environment. As a lead and member of the implementation team, I pledge to work with you to address our common challenges as we go through the design and build process. I'm committed to supporting you so that on July 1, 2020, when we go live with our new system and business processes, we come out with a much stronger, more capable and improved financial system that will continue to mature and support the growing needs of our business here at UC San Diego for many years to come. Thanks again. I look forward to working with you.
So that was really difficult for all of our finance folks because they're all introverts, right? But they did great. It was amazing. And so without further ado, let's go ahead and move on to the agenda. Let's see here. Okay, so this is our agenda for today. We're going to start off with CFO Houillet, Pierre, and Laurie. And so, Pierre, you want to come up?
Thank you, Kevin. I'm not an introvert, but I have a terrible accent, and I realize you probably have no idea what I'm saying. But I won't very much speak to the slide, but I wanted to give you kind of context around the method behind the madness and kind of the journey this campus has been on for the last 4 or 5 years. I think I like to say that great universities have a vision, but if you don't have the infrastructure and the ability to execute on the vision, it's kind of useless. And so Pradeep developed the strategic plan kind of 4 or 5 years ago, and one of the key thrust in there was to develop an agile and sustainable infrastructure, and that has been a key driver for me over that period of time. That's a very broad statement, and there are many building blocks that we have been working on over the last 4 or 5 years. And I just wanted to start by saying this organization is undertaking so much change. I don't think I've experienced that much in my career, and I spent 20 years in the private sector before joining the higher ed 10 years ago. This is pretty incredible, and you look at everything that's going around us in terms of organizational changes, capital programs, enrollment increase. It's like staggering. I don't think any university is coming close to what we're experiencing here. What I wanted to convey, though, is there is a method behind the madness, or some method at least. It has been a multi-pronged approach. So we have done kind of foundational moves early. Some of them were organizational in nature. For example, we had a very decentralized IT function 4 or 5 years ago. It feels like a long time ago. It was only 3 or 4 years that we integrated the administrative units, and then academic and administrative IT. That was a very major shift. We couldn't do what we are doing today without having a much more integrated IT function. So that's just kind of one example. Another example of alignment was between the campus and UC San Diego Health. We are so much more integrated now than we were 3 or 4 years ago. We're so much more integrated than many other campuses, whether it's UCLA or Irvine or Davis. I mean, I've straddled both organizations all day long, and it gives us absolutely unique opportunities in the common language, and Laurie and I are very connected all the time. So just a couple of examples of major organizational shifts, and I could go down the list. We did a ton of work around just process improvements as well. We have a very thorough kind of budget process today that we didn't quite have a few years ago. I mean, Sylvia and I spend maybe 80, 100 hours in budget meetings. Laurie does the same as well. It drives a ton of alignment. It brings a ton of issues. We're able to solve so many issues through the process. I could speak about the IT governance. Again, we put in place a very structured governance to oversee academic IT, research, infrastructure, ESR under Kevin's leadership, and so forth, data management, analytics, and so forth. So there has been a very consistent approach, and I think fairly coherent, around doing some very targeted organization integration moves, building some fairly core processes, building some capabilities. We didn't have a treasury function 5 years ago. We have did a lot of capabilities in key areas. We have done a ton of moves as well to make sure we have a financial path towards financial sustainability. So every year we look for efficiencies. We may have 30 or 40 projects that are driving efficiency in different areas. We do a ton of work around revenue diversification as well. So just to give you 3 examples, our investment income through great treasury management has increased by $30 million every year from what it was 4 or 5 years ago. Our real estate function will bring $20 to $30 million more annual revenue in 5 years than kind of 2 or 3 years ago. We're doing a ton of work around academic program development as well, with kind of master's programs, concurrent enrollment, and so forth. So we are really trying to make sure that this place has a great future, not just today, but kind of 5 or 10 years out. But it's a tremendous amount of work. It's tremendous tension on our people and our processes. So the underlying kind of key driver for me is how do we simplify everything that we can every day? There are many ways to do that. We have, I think, over 2,000 people who are trained in Six Sigma on the campus. We're encouraging everybody to to look at ways to do things in a way that's more streamlined or more simple. We made some major changes. So we did the SOFI Simplified Operating Fund. We implemented that 2 or 3 years ago. Remember, we had all these kind of cut-off money funds, and we decided that green was the cut-off money in the US, and we would really simplify the way we transact and the way we report. Many of you are involved in the chart of account renewal right now, which is another way to really kind of dust off what we have and go into the 21st century. And having these building blocks in place allows us now to really renew systems and our technology. We couldn't have done that the other way around, and I think that's a mistake that many organizations do. So hopefully now we have the foundations in place. We have a fantastic team. We have a very cross-functional approach. You guys are kind of all part of that. So my key message was, it's a journey. I think we have done a lot of preparatory work that brings us today in a position where I think we can safely execute on what will be the biggest kind of IT transition this campus has ever experienced. I'm extremely confident in our ability to do that, and I'm very grateful for what you do. So I'll pass the mic to Laurie, who is going to talk about the health side of things. Thank you very much.
Okay, no, you were great, Pierre, thank you. For those of you that don't know me, I'm Laurie Donaldson. I'm the Chief Financial Officer for UC San Diego Health. UC San Diego Health consists of not just our medical center, but also our physician group and what we call our population health entity, which is our managed care entity and our newly created Medicare ACO. So the health system has grown significantly over the years, and we're now a $2 billion organization. And I also want to, thank Pierre and thank the Chancellor for really having the vision to do this system renewal project and to also invite health into the fold. This is really the first time that the health system and the campus have really collaborated on such a major initiative. I was thrilled when Pierre asked me to be the co-sponsor of the FIS portion of this project, and it's really been a team effort. Lots of individuals across all of campus and across all of health participated in the selection process. And once again, I just want to say that, we were really thrilled to really be able to do this collaboration. I want to thank everybody that helped us pick a system that's really going to meet the needs of an integrated health system. Many of you may know that the medical center has some kind of unique reporting requirements that go up to Office of the President. We're with the other UC medical centers in kind of an obligated group structure for doing external financing. So we have some unique needs. So over the past 28 years that I have been here, the health system's always done its own thing. We've been off over here doing our own thing. We had our own financial systems, and our financial systems would talk to the campus systems. But that creates an awful lot of extra work for us. But up until, Pierre had this vision, we didn't think that we could all be on a shared system together. And now we're going to realize that vision of being on a shared system. So this slide here just gives us a few statistics about the health system for those of you that may not know how large we are. As I said, we're really a vital part of this community. We're very aligned with our School of Medicine, and we provide, care across the San Diego community, across the Southern California region, and we also have a lot of patients that come to us for specialized services from across the country, and we also have a lot of international patients here as well. In fact, tomorrow I'm meeting with the medical ambassador from the Kuwaiti embassy. So we do have a very large international presence as well. And so this general ledger system that we're working on first is going to replace the hospital's general ledger system. But right now we're going to keep the budget systems and the decision support systems, the purchasing system, and obviously the health system's electronic medical record, which is Epic. So we're going to be keeping those systems, but we're going to be replacing our old antiquated general ledger, and this new system is going to talk to our systems. As you're going to see later on in the presentation, there are lots of implementation teams in place. Every single one of those teams has a representative from health. We are also in the process of standing up our own internal health kind of project management office to make sure that we address all of the unique needs of health when it comes to this new system interfacing with things like our electronic medical record. So as was said earlier in the video, this is the first time that the health system, the campus, and also the foundation are going to be on a shared system, and we're going to have a shared chart of accounts, and we're all going to be, doing the same thing at the same time. Instead of the campus closes, the hospital closes 3 weeks later, we'll be much more integrated going forward. So this last slide here just shows some of the benefits to the health system. So this is really going to drive a lot of efficiency and provide us with a lot of real-time information. Because the medical center has been running its own general ledger all these years, we don't have one true source of data. If you look something up in the medical center system and then you look it up in the campus system due to timing, you're going to get different numbers. And you're not going to know which one you should be using. So this is a major improvement that we're going to have. There's going to be really one source of truth. We're hoping that by eliminating the need for our two systems to talk to each other, that it's going to make everybody's work much more enjoyable. It's pretty boring to sit there and reconcile general ledgers. So that work is going to go away, and we're hoping it's going to allow our finance staff to really be able to be more creative, be more innovative, do more data analytics, and we're hoping that this is really going to provide some career opportunities for the finance team as well. So I just want to close off by once again, thanking everybody that has participated so far. As Pierre said, this is a journey and it's a lot of hard work. And we really appreciate those people that have volunteered to work on this project. The people that are working on this project are members of our internal team that raised their hand and said, I want to do this, I'm excited, I want to bring my expertise. And then we're funding staff to come in and replace the daily duties, that they're not going to be able to do while they're working on this project. So I just want to close with just a big thank you, and we're committed to make this successful. All of the finance team on the health side is committed, and I know, Pierre and the rest of you are as well. Kevin?
Thank you. Thank you, Lori. Thank you, Pierre. That's perfect. Okay, so we're going to be jumping into our agenda now. So we're going to have some folks coming in to talk about the project, more specifically some of the changes that have already started to be designed and what's going to be coming up in the next 90 days. And then we'll step into change management. So with that, Cheryl Ross, our AVC and controller for the campus, and the finance officer for health sciences will kick us off.
Welcome, hello. I don't know everybody here, but a lot of you do know me, so I'll just reintroduce myself. I'm Cheryl Ross, I'm the University Controller. I'm also a Finance Officer for Health Sciences, as we talk about integrating and the whole campuses together. This has been a great journey. Lori and her team have been great partners on the health system side, and I think we've accomplished a lot, and our sister campuses are amazed how we can do this. So we're in a good place to get started. Talk about design. Our whole project success relies on design. This is the part where we make this tool ours, and it's as effective and efficient as possible. So we have great design team put together, and guess what? None of them are consultants. They are us. And that is key to how we're doing this. Sorry if I'm moving differently than my microphone. I'm not a professional, I'm sorry. But that is among the key messages I want to get out, that we are doing this. We will have, or we do have, implementation partners from Deloitte. And they are experts in Oracle, they are experts in higher ed and in health, and they are experts in implementing this in those institutions, those kind of institutions. But they are our advisors and partners. We are the leaders. And so when, after me, when Bill stands up here, Bill's it. So for functional, he'll have a partner, but we will design it. The people here and remotely are the ones who know what we need, and we need those people being the design leads. So this is extremely important. We've worked together for, gosh, has it been, I guess it's been a year, a little over a year on the chart of accounts. And this was a great move because we did this all in advance. Some folks, I won't mention any campus names, are doing this as part of their implementation. And there's enough craziness going on during implementation that you don't need to be figuring out your chart of accounts at that time. So we've done that, and we've done that together. Over 40 of you around campus, foundation, health science, health systems have participated in this design. So it's because it's the foundation to make it work for us. What else am I supposed to say? Okay. The system is going to take care of a lot of things that we have trouble with, so that we're fully functional. We're going to centralize non-student AR, which we've already started working on for, I don't know, Susie, how long? But we've started that in health sciences, and we will be able to bring that, what we know and have learned there, to the rest of the campus as far as the methodologies we should be using, how tools should work for us, what are all the wrinkles. And that's one of the things when we say getting rid of shadow systems. There's a lot of shadow systeming going on in the AR area. The budget tool that we'll have, early on when I was here, people would say, so what do you use for budget? And we say, well, it's sort of a bunch of things. So we're going to go from a bunch of things to an integrated, complete tool. It will interface with budget on the health system side, who already have a real tool. So all of this is part of the design good news that we have. So there's a lot to look forward to. What did I miss? Partnership. Lori has already stated this, but I will just re-mention it about our partnership, as I mentioned, with health. And I was surprised when I came here that we had 3 general ledgers. That was a new thing for me. And one of them is the AVES that many are familiar with. But there's DBS in the health system, and then Foundation has their own ledger. And Foundation happily is being part of the chart of accounts design and review the Oracle tool, and we're able to say, we can come on with you as well. So guess what? We truly will be on one general ledger. And this is great for a lot of reasons and reduces certain kind of risks of working out of multiple systems. So it's going to enhance that way. The other point that is really important and will come up and bother us throughout this is that we need to do what's best for the institution as a whole as we design. Everybody around has wonderful ways that they do things, and there could be 52 different ways we do the same thing. But we've got to choose one. And we choose one based on primarily what the system does, because guess what? They've seen more than 52 ways. So when the system has a way of doing something, we call that like best practice. Our goal is to use the best practices. We will not be customizing to match everybody's favorite shadow system. And everybody who has a favorite shadow system doesn't really understand what a real modern system does anyway, so you won't need the shadow system. We configure the system, the design people decide what's going to be done there, but we do not customize for unique things. We find a way within the system to make it work. And this is efficient, it's cost effective, it reduces risk, and there's a lot of good reasons why we want to do that. So I want to make sure that everybody understands that, because as we get more into it and design people talk to you on your SMEs about specific needs, and you'll say, but we have to do this way, because this is why we do this, and you'll have very good reasons based on an antiquated system that you need to do something a certain way. So I really want to emphasize, like, opening your eyes and minds to a different way. As Bill will say, we're going to break what we do. Forget about what we do. Let's not do it in the context of this is what we've always done, but in the context of this is how the system handles this kind of thing, or figuring out with our partners how the system could handle that sort of thing, because it is highly configurable. And so this is an important thing, because you're going to be pressed on this, and you're going to say, well, that wasn't meant for me. That was those other people who do crazy things, but not me. So remember that when you're challenged by SMEs and design leads to do things in a standard way. And finally, this is the fun part. These are our design leads. This is exciting. I want every design lead, when I call their name, to stand up and wave. I don't think they'll all get to be on camera personally, but the pictures will be seen. So of course we've already met Bill. Bill, stand up. He's our access management lead, besides leading the whole darn thing. So, accounts receivable, cash and banking, Susilise Virgil. We're actually going to have accounts receivable, so that will be really great. Asset management, Jamie Wheat. There she is, okay, sorry. Budget and planning, Amanda Buss. Common chart of accounts, Jamie Nickel, who's still standing after over a year and is doing a fantastic job, particularly with negotiating with OP. Arlene Renslow, controls and compliance. Kevin Wong, disbursements and travel. Kevin. Melissa Navarro, I know I saw you, there you go. Melissa Navarro, as you see, general ledger. And post-award and project, Marissa Pro. And procurement, Maggie Gray. These folks are going to be living with you. They will be stealing your people, because we want the best people and best advice from our own internal forces to address this design. So please, suck it up when they ask for time for your people. I have sucked it up so much I can hardly breathe. So we will, a lot of those people work, in key areas, but if we don't put the best people on it, the most knowledgeable people, we won't wind up with what we want. So that's my message to you, to be patient. I think that periodically IT holds a drink fest in the Wednesday afternoons or something where we can all go. Social, you might need that sometimes. Okay. Thank you. Oh, okay. Well, I sort of introduced Bill already, but Bill, that was in the design lead part. Bill is also, of course, the business lead for the whole project, the functional side. And so he has a lot more serious stuff to talk about.
Thank you. And so I am a lot more serious. I'm an accountant, right? So good morning, everyone. My name is Bill McCarroll. I'm Director of Accounting for the campus. And in this role, I will be not only leading the campus, but working with the Foundation and Medical Center as partners. So we'll be working closely together on this. I want to give you an idea of the scope, because if you look at this chart, you'll see that we do all these things today. We have systems that we built over the years. We bolted them together, and they work pretty well. But they don't really work the way that we will work in the future with Oracle. We'll be in the same environment. So I can't see these things. So these things are going to be in the common Oracle environment. The general ledger, obviously. Asset management, so our fixed assets will be in the ledger or the financial system as well. Let me put my glasses on. This is terrible. See what happens when you get old? Accounts receivable is a big one. We don't do accounts receivable here well at all. On the campus side, there's really no coordinated, centralized process for AR. And I just don't want to scare Pierre into the revenue that we're probably missing, but I think we are. And Susie's done a great job in bringing that forward so far. Cash management, the treasury function is something we really need to build up. We need to understand how our cash is moving around. That will be, a key piece of the FIS. The project management portfolio, so the way we do post-award today will be significantly different in a sub-ledger. So we'll use a project module in Oracle and actually manage that and keep the ledger clean. So that is really a huge part of it, and we're looking forward to using that. I think it's going to be really powerful. Procure to pay, so we're still thinking about how we are going to adopt the procurement system. We may move into Oracle, we may stay with Marketplace. That's an integration decision that we're still considering. So, but in the future, definitely, I think it will be a move into Oracle. It may just be a timing thing. We may not do it for July 2020, but we will have a procurement system, obviously, in the system. Financial planning and budgeting, I'll go through this later on, but we are going to implement a budget module for the first time. Today, as Cheryl said, we do a lot of budgeting in Excel. The budgets now will be kind of brought together from the bottom up, centralized, and there'll be visibility so you can drill down into how budgets were actually developed and approved. And then master data, that's a huge thing for us. The data that we currently have comes from all kinds of different sources. As Lori said, it comes from medical center, it comes from different databases, it comes from whatever you looked at in a table. It'll be single sets of master data. Okay. So how are we going to do this? Well, actually, we're going to have the design teams, and it's not only the design leads that you just met, but it's also going to be a broader set of SMEs that are going to work in those design teams in each of the procurement, or each of the areas of FIS. They're going to actually design, they're going to sit together. These are our experts. They'll sit together in teams. They'll configure Oracle around the processes that we recognize as necessary to go live on July 1, 2020. And then we'll come back, we'll actually iterate, we'll come back and we'll kind of air those processes with our experts on campus. So we'll come back to the campus and say, this is how it looks, this is how we designed it, what do you think? And we'll take that feedback and maybe redo some things or maybe press on with what we've already designed. But there will be a lot of stakeholder vetting as we go through this. I anticipate we'll probably do this three times is what the plan is today. So that iteration process will go over probably a period of 6 months. Okay, this. This is what's really driving all the change that you're going to see. We've been working on a chart of accounts, common chart of accounts with UCLP since 2012, and it's involved the controllers at the medical centers and the other campuses. And they came up with a common chart of accounts at a very high level. So this is the structure we see today, but we've worked a lot on this with UCOP to actually drill down and define the detail, and we're almost there. But so there's a lot of things that look very familiar here. Entity, obviously, is going to be the medical center, foundation, and the campus. There'll be 3 separate entities in the GL. That's how we'll keep them separate. Fund, everyone knows what a fund is. But in the new system, a fund is not going to have the same characteristics as a fund today. I mean, we create a separate fund for almost everything we do, separate funds for every award that comes in. That's not going to be what we're going to do in the future. This will be the source of money that actually comes in from an agency or a gift. It'll be at a very much higher level than it has been in the past. Let's see, department. That's something that we've really tightened up in the new chart. If you look at how organizations are used today in IFAS, orgs are used for all sorts of different things besides what really is a department. So we've cleaned that up significantly. And then account, we're redoing the account structure to take advantage of the power of the chart. So an account may be shared with different departments across campus, but they only need one account because it's the same characteristics in that account. Function is the old program, the Nakubo kind of characteristics that we report on our detailed financial schedules. Those will be simplified. I think we're going from a few hundred to just about 44. So it's going to be slimmed down quite a bit. The new fields that we're looking at, a flex field for activity. So this will be kind of like what you use today for index. You'll be able to track things that are particular to your business area that you want to keep track of separately. Location, we're going to use master data from Tririga to actually define the characteristics here. So you'll be able to kind of tie, if you want to, these are kind of optional fields. If you want to, you can tie your expenses or revenue to specific locations on campus. And this will help with our financial analysis office for IDC as well. Program is really just, we're going to keep track of things that come at us from UCOP. So these are common programs across UC that UCOP wants us to actually track for them and report up. So they're usually central kind of level programs. And then the big news is index, as you know it today, goes away. And this has significant impact on how we actually map from old to new. We'll try to give you some shortcuts in the tool. We just have to see what's available in the tool itself. But we'll give you a shortcut if we can, through an alias perhaps, but we're looking at that as well. So I just want to give yourselves a hand, because I think this has been a significant effort. In the last 6 months, we have gone through cleanup of our old AVES accounts, and we've seen an 11% reduction in the number of funds. And there's a lot more to come in the capital area. We probably have 1,000 or so that we're going to get rid of. We've seen a 39% reduction in the number of active orgs, and this goes back to the department cleanup. They really weren't all departments. A lot of them were cost centers. So we found ways to clean those up. A 36% reduction in active accounts and 87% reduction in program codes. Number of indexes that have been laying around without really any activity in them. We've closed 28% of active indexes over 25,000. It's been a huge effort, and I just want to thank everyone for your participation in that, helping us get through that. So why is that important? Well, we don't want to carry old data that has no relevance or use into the new financial system. We want to bring in data that is going to be acted on, it's going to be managed in Oracle. And if you look at some of this cleanup goes back to the old DAISY days, when we actually moved from DAISY into AVES, believe it or not. So some of these cleanups actually are a reflection of that activity. It's been languishing in the AVES system for 30 years, since 1990. So the launch. We are looking at the budget module going live with the budget module in January 2020. And the reason we want to do that is so that we have budget data in the system for fiscal year 2021 on July 1st. So it'll be a smaller pilot program. Not all the campus will be involved in the budget, building a budget in Oracle beginning in January. We'll pick 3 or 4 key areas and take them through a pilot where they will actually build their budget in Oracle, and then we'll use that data to feed the system in July 1, 2020. For areas that aren't going to be participating in the pilot, we'll take their normal budget input and we'll feed it into the system so it'll be available. It just won't be built in the system in January. And then we go live on July 1, 2020, and we'll go live with the capabilities that we can build in, as much as we can build in. But the go live date is a firm date. If we have to adjust the capabilities in the system, if we have to narrow it down to just the minimum capabilities, we will. But we want to go live on July 1, 2020. And then after that, there's post-launch. So there'll be enhancements to Oracle for 2 or 3 years before you really see all the benefits that come out of the system. There are things that won't be available on July 1, 2020. So we're going to ask you to be patient with us. It'll be a robust system, but it's not going to be the Ferrari that you're going to have, 6 or 12 months down the road. So I'll pass it over to Aaron. Thank you, everyone.
Thank you, Bill. And thanks everyone for coming and for the folks streaming. It's really nice to see all the familiar faces. My name is Erin Kilburn. I'm the project manager for the financial system implementation. And I wanted to give you an overview of the project structure. So this is similar to all of the ESR projects. We have our sponsors who you've met. We have our escalation, so Cheryl and folks from the health side, and then the appropriate VC is needed. We also have our governance group, which is senior leaders from across all 3 of the entities. And then we've got a myriad of project teams. So we have our design leads, who you met, their teams within that, the design SMEs, extended, our change network, which hopefully you've heard a little bit about, but you'll hear more in this presentation as well. Every single department on campus has representation, and we intend that to be a 2-way feedback loop, and then our technical leads and those teams. So how are we making decisions? As Bill mentioned, we want this to be iterative. We're going to be configuring this tool, and we've selected design leads who we think are the right people, who understand not just the current process, but have a vision for how this can be in the new tool. They have relationships, they are listening, they're engaged. We've done all this gathering to even get through procurement. We've got folks at the design team, SME level. That being said, it's possible we're humans, right? We make the wrong decision, or you think it's the wrong decision. So we also have a process for that. You are encouraged to write up the analysis for the business case on the proposal. Why does this need to be changed? And there's a pathway all the way up to Pierre and Lori for hearing that out. I hope that we don't have many of these. I hope we make the right decisions, but this is the real world, and unfortunately we do make mistakes or need to change. All right, so timeline. This first one is over many years, and I want to highlight this to just really paint the picture for how much thought and analysis has already gone into this. And the chart project, the idea for that started in 2012, so many years ago. And so much work has been done across the system to get that standardized, to really think about what's meaningful and efficient for all of us. And as Bill mentioned, it's very close. They've made a ton of progress. And then the other piece why I want to paint this picture is we've put this box around what the FIS project is. And I want you to maybe think of the end of the FIS project as really the beginning point for all these other systems. So the goal here is to get to that point so that we can continue to enhance. So drilling in on that box for what is the FIS project. So we're about halfway through that. We've completed procurement, wrapping up chart, and we're warming up and beginning our design and configuration. Right on the heels of that, we need to start working on integrations for our key systems like Epic, ISIS, Quality Research. And then we also want to partner with all of you, and that downstream inventory that we requested you fill out in November and December, make sure you understand what the impacts are and what you need to do. Do your new processes in Oracle meet your needs? Do you need to refactor some of your integration points? So that will be more coming next year. All right, that was very high level. This is still high level, but within the next 90 days, what are our key milestones that we're shooting for? So first of all, we need to get all of our design leads experts in Oracle, so that they can help steer and guide and make the right decisions. So that is launching and should be wrapped up by the end of April. We need to make some decisions on our travel tool and our procurement tool to finalize our scope. And we need to make decisions on our integration. So all of that needs to be done so we really understand the full implementation and what you all and your teams need to be trained on. Related on the learning activities, so the data warehouse is going away. I encourage you to learn more. If this is news to you, there's actually a community of practice this afternoon, which you can stream. If I just terrified you with the news that the data warehouse is going away, there is a people manager training which you can attend to learn how to support your teams and your staff that are experiencing all this change, that are being asked to streamline their processes. And then we are also having a chart of accounts Q&A, so a 2-hour session to really drill in on the details of what's changing, how does this impact me, this entire schema is going away, no index, what does that mean, and we can talk about that. So now that I've suitably, hopefully not too much, but terrified you with all these changes, I'm going to pass it over to our change lead, Bernadette Hahn.
Thank you. That's quite a setup, eh? All right, so I wanted to just share with you how we're addressing the people side of all of this. What I love about the ESR program is that it is fully sponsored by executive leaders, senior leaders. It is well planned and integrated across the projects in ESR, and we've thought about the people side of change as much as we've thought about the technical aspects and the business process aspects of what we want to do to create a fully integrated system. So our change management model is designed to target a level 3 organizational maturity model. And I consider this a sweet spot for us, given where we are as a university, because what we're doing is we're approaching managing the people side of change in a way where the projects can be flexible, nimble, and independent within ESR program and share their best practices across projects through the program structure. And then the program team members can quickly apply those best practices across projects so we can quickly share learnings along the way and not have to wait until the project's over to do any postmortems or debriefs and apply learnings that way. So this is a nice way for us to be agile and provide the appropriate level of infrastructure and support at the program level to give projects a way to share information and get coordination and support. We've also ensured that we are making decisions based on insights and learnings from organizations that have applied these kinds of technology changes globally. And the organizations have been researched over 20 plus years by an organization called ProSci, which uses a scientist practitioner model. So we want to make sure that everything we do has been vetted and researched, but based on what organizations out there are actually doing and what they've found to be most successful. So all of our program and project structure is designed to address these things that you see in front of you. We've got active and visible executive sponsorship, which I think we're showing you today, right? We're walking the walk and talking the talk. We're making sure that we've got dedicated change management resources, appropriate structure. We're going to ensure that we find all of the ways like this town hall and trainings and other newsletters and website information and all of the vehicles to engage and invite participation from staff across the entire university. We're going to ensure that there's frequent and open communication, whether it's one-way or two-way. And the beauty of this approach is that we are truly integrating project management with the people side of change. In this work, I've discovered that North America separates project management activities from change management activities, and places like New Zealand and the UK integrates the roles. So we, as a university, are actually designing this in a way where we're integrating the functionality of people management, change management, and project management. And the project management office that Erin is a part of is working on having this fully integrated project plan so that we're not thinking about the people side afterwards, and we're planning for it in advance. This is a visual to show you high level that each change practitioner and change lead in each project, which, who I will introduce shortly, has a responsibility to account for the people side of change. So not only managing the technical side of the project, people are thinking about, okay, we know that people have certain needs. We know that there's a psychology of change. I mean, Erin joked around about, instilling fear in you, but there is a bit of of a reality to what happens when we announce that we're going to change the way that you're going to do your work. We're going to change the way that we're asking you to orient your mindset, your attitude, new forms, new steps, new technology. All of those things actually have a reaction that we have to process. So we're going to set up the program in a way to ensure that we're going to create communication, training, sponsorship, resistance management activities, coaching support, and all of this is baked into plans over time where it's oriented around you as a person. So we want to design our plans to ensure that we're supporting your outcomes. Are we giving you the right information at the right time for what the changes are going to be, why we're doing it? Are we supporting you and equipping you to help you get trained on the new technology or the form or whatnot? And are we setting this up so that it's not flavor of the month, but it's actually going to be reinforced and sustained over time? This is a true integrated, multi-phase business transformation, and we are going to quickly become like 22nd century university. So we are truly changemaker status, and I don't know if you know this, but we were changemaker status month in January. So I love that we on the staff side are also contributing to that changemaker status by doing the work that we're doing in this manner. So this page is the final page I'll share with you, and the purpose of this is to show you that we truly have structure in place intended to support all of the projects, which are intended to provide structure and guidance for all of us staff in the various projects. So you've met Kevin Chow, the director of the ESR program. You've met some of our executives who shared with you the vision and the purpose for what we're doing. We have other areas covered here: procurement, architecture and program management, expert sourcing, which is what I believe Lori mentioned earlier, where we're using our internal, and Cheryl mentioned earlier, where we're using our internal staff to do this work rather than relying entirely on external consultants. We have strategic organization change management, marketing, communication. So hopefully this shows you that we mean it, it's happening, it's well thought out, well planned, well designed, and well supported. With that, I'm going to pass the mic over to our two change leads of the FIS project, Arlen Renslow and Adam DeProfio.
Thank you, Bernadette. Gosh, it's so good to see so many familiar faces here this morning. And many of you we've been working with since November 2016. If you remember, we started gathering all the business requirements around that time. It is so exciting to be part of building this agile, supportive infrastructure for UC San Diego. And this project, this new financial system, is not just an ESR team project. We're all part of financial operations, so this belongs to all of us. So we have a shared responsibility in this great transformation. This slide basically shows what we can all do to help. So I'm going to highlight a couple of them. You heard from Bill McCarroll earlier that we're going to break everything in our legacy systems and processes. Well, that's our call to action, is to break things and make them better. It is also our call to action to challenge ourselves to do things differently. And we're also called to increase that awareness that we are really working towards improving our transparency and our accountability. Our new financial system is going to enable us to strengthen our financial controls and help us in achieving the fulfillment of our compliance requirements, reporting, regulatory. So this is part of our work in enhancing and protecting the public trust as a public entity. So this is something that we should always be talking about with our teams, that this is a strategic priority and our commitment to make sure that we have financial stewardship and data integrity. So another way that we can help is really actively participating, like you are doing today, by being present and by personally engaging with your teams, listening, encouraging change management efforts in your departments, and of course, promoting the adoption of our new Oracle financial system. And, importantly, we want all of you to continue to be the direct source of feedback. You've done so well in this. We want to hear from you. So as we build our financial system, we hope we hear from you directly, any issues, any concerns, so the financial core team can immediately address them. Don't keep it to yourselves and worry about it. Bring it forward so that the financial core team can address them and bring them to resolution. So nice to see all of you today. And now I'm going to turn it over to my change management partner, Adam DeProfio.
Thank you, Arlene. My name's Adam DeProfio. I'm the Director of Finance and Budget for Academic Affairs. I'm also a co-change lead for the academic side of the house. I think better when I move, so I hope you don't mind me going back and forth. You'll also be happy to know that I'm the final speaker before we get to Q&A, so we're now at the home stretch. So I hope as you're sitting here listening to this, that you kind of get the sense that this is different. Okay? The ESR program is different. FIS is different. This is a different project from the way that we've run projects in the past. I'm hoping you're feeling that. And when I say this is different, what am I talking about? Well, I'm not just talking about having a town hall. I'm not just talking about a nice video. I'm not just talking about having our sponsors present and engaged. I'm not just talking about the great newsletter that goes out. I'm not just talking about the website. I'm really talking about all of it. And all of those things I just mentioned are just a small part of it. Those are really the visible things that you will see. There's also a whole bunch of planning, organization, architecture that goes behind the scenes that you don't ever see. We got a little taste of it today. You heard about the design principles, the project structure, the design teams, the escalation process, the organizational change management. All of that stuff are things that are different. We're really spending time on. We really want to make sure that we have the infrastructure and the basics in place. Why is that? Because over the next 18 months, and even beyond 18 months, there's going to be a lot of work. A lot of work's going to be happening behind the scenes. You're not going to see a lot of it. And what I'm hoping is that we've shown evidence that we're doing the best we can. We have the planning. We're planning as best we can. We're starting as early as we can. And know that as things are happening, you might or might not see it, but hopefully give us the benefit of the doubt that we have the right teams in place, the right expertise to get the job done correctly. Is it going to go perfectly? No. Are we going to mess up? Yes. But hopefully, again, we've set things up so that we can course correct, we can fix problems, we can get to July 2020, and it's not all going to be perfect. I hope everyone's ready for that. But that we can then, as quickly as possible, set things up to make it better. Okay? So I'm going to ask for a little bit of trust. At the same time, I know some of you are skeptical. I can see some of the eye rolling. So yes, I've heard this before, okay? And me just saying the words that please trust us is not good enough, okay? So again, we want to have as much evidence as possible. So what we want to do is share as much information with you as possible. We know you have questions. We know you want to be informed. Okay? It's not feasible for me and Arlene or any of the core team to talk to every single person about every single change over the next 18 months and beyond. So hopefully you'll read the newsletters, you can see the website, but in reality, that's still not enough. So we've set up something called the Change Network. I hope at this point that everybody's familiar with the Change Network. Ideally, everyone has had at least one meeting or multiple meetings with their Change Network contacts. If you haven't, if you don't know what the Change Network is, essentially the idea is we want to have representation from all the vice chancellors, and that each division and department within each vice chancellor has at least one point of contact that they can go to get information about what's happening, and then also to relay their questions. So if you have no idea what I'm talking about, or if you've never heard of the Change Network, what I encourage everyone to do is to go to our website, esr.ucsd.edu/FIS, and on the left side, there's a page that says Change Network, or a little link. So you click on the link, and you'll see something that looks like this. On the left side is every single vice chancellor on campus. So if you don't know who your Change Network contact is, you can go to your vice chancellor, you can click on it. In this case, I clicked on Marine Science, And you can see that there is a primary person who is a contact for each vice chancellor. And the change management team, myself and Arlene and Laura, we will meet with all of the vice chancellor contacts, hopefully on a monthly basis, to let them know what's going on. Okay? Then each vice chancellor contact will go and they have a list of contacts for each division and department in their area, and they will meet with those contacts. And then those contacts will then turn around and go out to the individual departments and divisions and the frontline staff and share the information. Okay? So the idea is every single person on campus can have a direct conduit to get information and a communication channel up and down. Okay? So the idea is the design teams are going to be working hard. They're going to be creating new activities. They're going to be making design decisions. The core team's going to have information. That's all going to get bundled up. We're going to produce content. We're going to take it from the change management team to the vice chancellor contacts. The vice chancellor contacts give it to the department division contacts, who then turn it around and pass it out to the frontline staff. And it works the other way. So if a frontline staff has a question, they can go to their change network contact, who can then route it up, and we can find out what's going on. Okay? So why are we doing this? Because again, just saying, trust us, see you in 18 months, is not going to work. Okay, so we want to make sure there's a lot of information that's going to be imparted, and it's going to be happening. It's going to be happening fast, so we want to make sure we distribute it out to everyone as soon as possible. Okay, and then you'll hear a lot of it. Some things that are going to be happening behind the scenes, again, you're going to have to trust us. We're going to do the best we can, but through the iterative process with the design teams and the communications to the change network, hopefully that will help keep everyone informed as much as possible. Okay? So I know you have questions. I know you have questions. We've seen some of the questions. So actually, just right before the town hall, we sent out a brief survey. And the survey asked some questions of our own, some general assessment as to where things are at, find out what some of your concerns are, and what some of your questions are. So I'd like to take just a couple minutes and show the results of the survey. So the first two questions are really a general assessment. Number one, are you aware that we're moving to Oracle Financials? Okay. You know, it's an important question to ask, and I'm glad that we're close to 90%. I mean, at some point, we're still very early on in the process. I'd like to get that last 11% that had no idea. Hopefully, they're watching this video today, they know what's going on, but 90% or so at this stage of the process is actually not bad, okay? The other question is, do you understand the objectives of the FIS? And the majority of you, it's yes. About a quarter, maybe, and 15% or so, no. So again, early on in the process, that's actually not bad, okay? So I'm hoping that from today and all of the future meetings and the change network, that hopefully we'll shift all of those maybes to yeses. Some of the no's will maybe come along to maybes. We'll never get to 100%, but hopefully that'll move things in the right direction. So although I'd like to see those numbers better, I'm encouraged as to where they're at for now. And then we have, what are your concerns? And I look at that list and I think, yeah, I agree. Those are our concerns as well, okay? I'd like to focus real quick on the ones that were lower percentage, including insufficient communication and leadership transparency. Those are actually really, really important. So the fact that they were lower on the percentage either means that, one, the audience didn't realize they're important, or, what I'm hoping, my hope is that we're doing a good job, that our leaders are transparent, we are communicating, and so therefore it's not a major concern because you know I'd have it covered. At least that's what I'm interpreting that as. So the other ones that are red, yes, these are concerns. The chart of account is going to be a major change, business process change, and there's always a concern about training. I don't think I can get anywhere 2 minutes into a meeting without someone saying what's going on with training. So yes, these are all of our concerns. Unfortunately, we're not going to be able to address all these concerns in the immediate future. Chart of accounts is going along quickly, so that's one that hopefully over the next few months, you'll be hearing more, learning more, and feeling more comfortable. Business process change is going to be ongoing. 6 months, 12 months, 18 months. So I would love to be able to say, yep, we can share everything with business process change in the next month, but in reality, our design leads have not even been trained in the system and won't be completely trained for 2 months. And then we go through the process of iteration design. It's going to be a while before we actually have tangible things to share. And then likewise, training. I've already had people say, how come I haven't been trained on the system yet? Well, we haven't even configured the system, let alone know what the training is going to look like. And even if magically I could train you today, the average end user is not going to be into the system for 12, 15 months, depending on if you're involved in training or not, and involved in the pilot programs or not. So even if we trained you today, you wouldn't remember by the time we get anyway, by the time we get to launch. So I'm going to ask everyone to be patient with the business process, be patient with training. They will be coming, but they're not going to be coming for a little while. Okay? So those are the questions that we asked. But then we also wanted to know, what questions do you have? And we got a lot of feedback. So thank you, everyone. So we have about 20 minutes left. So what I want to do for the next 20 minutes is go through some of the questions that came in through the Q&A. We've bundled them together into groups. And then what I'm going to do is bring up some of our core team and leads to bring them back up and address some of these questions from the Q&A. Okay? So the first question we got, or set of questions, is based on our systems. How is System X going to be integrated into Oracle Financial? And there are literally hundreds and hundreds of systems, but we figured we picked the top 3. So what I'd like to do is invite Bill and Lori up. And Bill, if you can talk to the first 2, how is UCPath going to fit in, and how is ISIS going to fit in? And then if Lori can briefly talk about what the medical center is going to look like.
Okay, I'll take the first 2. Lori, I'll come up here too. UCPath. So UCPath, for us, go live is December 2019. So this presents a challenge for us for integration. If we're going live in December 2019, obviously we're not ready to go live with Oracle in December 2019. So we're going to have to map UCPath to our legacy AVES system. Then UCPath will migrate to Oracle for July 2020. So there is a significant amount of work to do both of those activities in parallel. We don't underestimate the risk that brings to the project, but we do recognize it. Let's see. Will the new financial system communicate with ISIS? Yes, it will. Today, ISIS sends data to AVES. ISIS will send data to Oracle. So we'll have to do that integration and mapping. That is a significant effort and risk as well. We will not have a new student system in place until probably 6 months to a year after we go live with our financials. But we are planning a new financial system, and we'll probably go out with an RFP later this spring or summer. So that will take place. So we will keep ISIS until we have a new student system.
Thank you, Bill. Before I answer the third question, I just wanted to make a comment about UCPath. Something that we realized when we were working on the UCPath implementation is that everybody's employee ID numbers are changing. And in a health system, your employee ID number is required to access patient records and keep them safe. So we have over 100 systems that use caregivers' employee ID numbers that have to be updated as part of the UCPath project. So I just wanted to point that out. When it comes to the medical center and integration with the medical center, as I said earlier today, the medical center's general ledger talks to AVES, and it also talks to the primary financial systems used in the medical center. So when we go live with Oracle, all of the interfaces to those systems are going to have to be updated. From an end user standpoint, the end users in health get their department financial information through our budget and decision support system, EPSI. So from an end user standpoint, they're not going to really be looking at the general ledger or working in the general ledger. That's pretty much limited to the accounting department. But we're going to have to completely rebuild our budget and decision support system, in addition to the interfaces that go to Epic, which is our electronic health system, and it's also used for all of our patient billing. The biggest change that we're trying to avoid when it comes to interfacing with our Epic system is that within Epic, everything is driven by cost center, what today we call organization. So one of the things that we partnered with Bill when we were doing the chart of account redesign was this would have been a great opportunity to renumber all the departments in the medical center, but that would have required such a significant amount of work in the Epic system that we chose as much as possible to keep them the same. And then the other big change that we have, which affects all of you in the room, is those indexes going away. And our physician group uses indexes. And so we have a real significant redesign of how our physician group financial statements are going to work. But we're working on it with Bill, and we're confident that the end result is going to be, you know, worth all the work.
Hey. Thank you, Lori. Thank you, Bill. So the next question we got a lot of is, but what about consultants? How are the consultants going to help out? What are they going to do? What's their role? So for that, I'd like to pass it over to Kevin, who can talk a little bit about that.
Thank you. So the strategy as part of Enterprise Systems Renewal is we want consultants to be here to teach us how to ride the bike. What does that mean? Right? And so imagine all of us as experts of UC San Diego's needs and business processes, but none of us are experts of Oracle Financial. And so the goal in engaging Deloitte is not for them to come in and do everything for us and we don't have to lift a finger, right? Because we've heard that before on many other projects in the past. What we want is we want Deloitte here as a coach, a guide, someone that can be here to walk us through by teaching us how to do it, maybe showing us while we're sitting next to them. And then eventually we're the ones exercising and operating the software with them as a coach, as a sounding board, and ultimately as support. And so that's how we're going to treat Deloitte. And so as we've been saying it, ESR is a team, it's a team of your peers. If you go on every single website, newsletter, structure, and roster, you will see that those that are implementing our software and our business processes are literally people that you work with every day. And that's the model that we want to maintain because we believe that the moment we go live is just the beginning. And if we are unable to exercise our own business processes, guess what? Things will change day 2. We can't afford, nor do we want to rely on any consulting firm beyond go live. And the only way to do that is to become proficient at riding the bike as soon as possible. So that's how our plans are for working with Deloitte, as well as any other vendor partner that will be joining us as part of our journey to implementing ESR.
Great, thank you. All right, the next question we get is based on training, and I'll take this one. So the questions we tend to get are, what's training going to look like? When is training going to be available? And my very favorite, are we going to have training? Yes, done. Next question. So if you might remember from the 90-day plan that we, at the end of April, want to have our training plan in place. So that doesn't mean have training material ready to go, but to have the plan as to how we're going to train people in the future. So we don't have any specifics at this point. I can tell you about the things that we're worried about, and if you know that we're worried about it, hopefully you'll know that we'll address as best we can. But I see 4 main issues. Number 1, we're going to have a lot of modules. You saw the box with all of the green and blue boxes that Bill went over. There are many, many modules we're going to be implementing, and that means a huge amount of training for a single person to learn how to use all of those modules. Number 2, we have a lot of users. If you look at just the quantity of people who are going to be accessing the financial system, it's huge. And when you put number 1 and number 2 together, that is just an enormous amount of training that's going to be really challenging. Number 3, we're going to have different business processes. So it's going to be one thing to say, oh, I used to do it this way, I'm still going to do it this way, but in a new system, that's, I wouldn't say easy, but easier. It's another thing to say, I used to do it this way, I'm now going to do it in a whole new way, which I have to learn. Oh, and by the way, I have to learn a new system on top of that as well. So we have to provide extra time to make sure that people can learn the new business processes that go with the new system. And then the 4th one is just some areas are going to require some fundamental basic training. Why? Things like budget and planning, project module, chart of accounts, business intelligence. Not everyone already does all of those things in their department today. So we can't just say, here's a new budget module, here's the screens, click here, click here, click here. We actually are going to need some fundamental training on how to do budgets and long-term planning in your department. We're going to need some training on business intelligence and what that means. So it's not, again, just pointing at the screen and making it work. It's understanding why I would need to use these new systems to get results. So how do we address all those 4 things? We don't know yet, okay? We can't just say, let's get everyone in classrooms. There's just too much volume to have one set of instructors teach everybody. So we can do a train-the-trainer approach, where we train people in departments to then train the people in their departments, and that can work. We can also do online classes. Not everyone likes online classes, some really do. We're actually looking at software that could potentially sit on top of Oracle Financial and act as an overlay to help guide you through so that as you want to do something, it says, here are the steps you do. And so the answer is all of that. We're not going to be able to do this with just classrooms or just online or just an overlay. We're really going to need a hybrid of many things to address all of those 4 concerns I have. Okay? So another way of what I'm really trying to say is be patient. We know training is a big concern. We will address it. We don't know how we're going to address it, but we'll take time to get there. So just don't call me up tomorrow and say, okay, what's my training look like? When can I start attending classes? All right? All right, the next question is regarding timing. So I'd like to bring up Aaron, our PMO, project manager. So essentially the first question is a polite way to say, yeah, I've seen projects like this in the past. When you say July 2020, should I assume December 2021 or July 2022? Can we really do it in 18 months? And then once we do launch, what's it going to look like?
We are absolutely launching July 1, 2020. It's happening. We need to keep our eye on the prize, as many folks have mentioned. It is the combined GL between campus, the Medical Center Foundation. If we need to, that's what we're going live with on July 1, 2020. That said, I think we can do a lot more than that. We have really smart people on this project, and they care. I have never seen leadership and sponsor alignment like is on FIS. A little bit of personal, but I left a career full-time job, applied to come be a contractor on this project because I think it is so special, the combination of resources at the grassroots, ground level, doing the work, and the leadership with the vision driving this project. It's happening. Will the systems run in parallel? They will be running in parallel, but we're not going to be doing parallel testing. So you may have heard of some cutovers where people are keying the same thing in 2 systems side by side. That is not the plan. The plan is that we key up until June 30th. We close the books in IFAS. July 1, we start keying in Oracle. That being said, there's adjustments, there's updates, we got to do the audit. All of that will occur in IFAS. So for a month, maybe 2, maybe 3, we're going to be needing to do some cross-system reconciliation, which we're planning to do primarily with jobs and scripts and checks. I don't think there's any reason we can't automate that. And we are not planning to make you do the same thing in 2 different systems at this time, hopefully. I don't see why.
Thank you, Aaron. All right, so the final set of questions we've got, we're going to address today is really based on reporting. And there are many, many, many questions, but essentially it boils down to what's reporting going to look like? I heard the data warehouse is going away. What does that mean? What happens to QueryLink? What happens to legacy data? What does the Activity Hub mean? So we have about 5 to 10 minutes left. So Kevin actually has some slides he can present and cover all that.
Thank you. So Bill dropped the big giant mic on the data warehouse is going away, and then literally like walked off the stage. So I'm here to clean up the pieces. Let's see how I do. So the data warehouse, as you know today, where you get data from IFAS, is going to stop getting data updates when Oracle goes live. We will not be loading Oracle data into the current data warehouse. And the answer is, the reason is because it can't be done. With the chart of accounts redesign, the structure of how things look and feel in DB2, in the data warehouse, is going to be drastically different. And so in lieu of doing that, we will be creating a new place in which future data warehousing will be done. So I'm going to talk a little bit about how you access data is changing. And there really is 3 main ways, 3 primary ways in which people get data today. Some of you, many of you, get data from what we call in-system reporting. In-system reporting basically just means that you go to our current financial system to get reports. What is our current financial system? IFAS, Financial Link, QueryLink, Easy Query, Excel spreadsheet, Access database, you name it, right? We got it. And we're going to continue to do that, but not in that way. In-system reporting will continue to be supported, except it's going to be supported out of Oracle. So what you currently do in terms of financial reporting, where data resides within the financial domain, those reports will be done out of Oracle. Now, how is it going to be done? What will the screen look like? Is it going to be a pretty dashboard? Is there going to be buttons and parameters? And how is it going to be done? I don't know. We don't know, right? But we'll find out, and we'll find out soon. So one of the things that we have asked folks to do in telling us how you're getting data today is because we want to make sure we're addressing those needs. Okay, so step one, in-system reporting will be there. It's just not going to come out of Financial Link anymore. It will come out of Oracle. Step two, many of you get data from our data warehouse. And as some of you probably know, we don't have one data warehouse. We got like a dozen data warehouses. Right? We just call it a data warehouse because it sounds more unified and consolidated. And we don't have one data warehouse. We got lots of data warehouses. Now, why do we have a data warehouse? Right? So let's think about what are we using it for? The reason why we have a data warehouse today is for some of those things that you see above. Customized reporting, however you do it today. Blending data, meaning taking data from COIAS, taking data from PPS, taking data from AVES, and blend them together so that you can actually do more institutional-wide reporting. And then the third thing is historical data. Some of the data that you need, you have to dig back where they no longer exist in a transactional system because those systems no longer exist. So you're going into the data warehouse to do historical reporting. In the future, same exact thing. We're going to continue to support the concept of data warehousing, except it's not going to be done out of the data warehouse you know today. Data warehousing will exist in one or more, quote unquote, activity hubs. Now, we have one of such activity hubs already in production today, and that is our student data warehouse, which consists of 15 plus years of ISIS data, as well as numerous bolt-on systems are now flowing data into the student activity hub. We expect there to be a finance activity hub. How will you access Finance Activity Hub? You will access it using industry standard tools, not programmers. Okay, I'll let that sink in a little bit. So today, if you want to get data out of the data warehouse, either you are a wizard of Excel, which I know 99% of the people in this room are, or you go hire a programmer. Programmer will go and move the data into one or more shadow systems, and they'll build you a website that pulls data and visualizes things. That's, I would say, 50% or more of all downstream systems in our inventory is currently doing. And so we want to continue to support that custom reporting capability, except the way that custom reporting will be done is using industry standard tools like Cognos, like Tableau. And so I highly encourage you all, if you have not already looked into it, is to participate and learn more about the activity hubs through the community of practice. And then one thing I will cover is that one of the things that Bill has been sort of leading the charge in making some of these very, very important decisions is the migration of data. Within AVES, we have lots and lots of data that dates all the way back to DAISY. For Oracle, because of the significant change to the chart of accounts, we will not be migrating everything into Oracle, which means we have to have some way of continuing to do historical reporting, not just for audit purposes, but because we will have a need to solve the passage of time issue. As many of you know, there are a lot of sponsored projects that span multiple years, and you will have a need to go back in time for many active awards, for closeouts, and for reporting. And so we envision that to be coming out of our future state data warehouse. Okay? And last but not least, integration. So what this really is a slide talking about is all of the bolt-ons that we have collected from our downstream systems inventory, or that registry, that was, I'm sure, nagging a bunch of y'all to put information in. The reason is because we recognize that there will be a need to support downstream consumption of data beyond in-system reporting and data warehousing. So for those of you, as you're working with the design team and you're identifying gaps in business processes or in capabilities that require you to keep certain processes and systems intact and simply remediate them. We will be working with you on modern integration techniques that will support how you get data in and out of our new systems. Okay, and so lots and lots of technical details that I'm not going to go into today, but we will make ourselves available. There has been numerous Q&As, and there will be more as it relates to how people are going to be moving data in and out. Our hope is that the vast majority of those reporting needs will be served through Oracle and through our new data warehousing solution, and many of the business processes that have had to be augmented through custom software will hopefully be met by our new implementation. That is absolutely priority number one, which is why this project being different than all the other projects, I remember when I stepped foot on the first town hall when we're looking at buying Oracle, I had literally had a number of people stood up and said, okay, just tell us what we bought. Like, I have no idea what we're gonna buy because we just started the RFP. And they're like, well, that's different because every single time IT rolls out software, they kind of went into a corner, they bought something, they built something, there's maybe 3 people involved, and then they come out and say, here's training. Right? So we're not doing it that way, and we're not doing it here, and this is why, as part of this engagement strategy, we want to make sure that we're addressing the broadest campus need possible. Okay. So with that being said, here's just a quick summary slide, and I do want to mention that a number of the core team members and design leads have volunteered their time, half an hour after this meeting, to be around, to have folks come up, informally introduce yourselves, ask questions. If there's anything that we didn't cover here today that you just absolutely have a burning question, we don't want you to leave the room without getting it answered. Okay, and so I just wanted to, get a chance to let folks know that if you're interested, please stick around after this. And with that, I want to thank you all for making the time to be here today. For those of you joining on the live stream, thank you all for texting me, letting me know the sound wasn't great earlier. We were able to get that fixed. We're iterating ourselves, and so thank you for doing that. And I want to give a very, very special thank you to an individual who made all the magic happen today, and everything that you have seen as it relates to this project publicly, through communication, through newsletters, through Zoom meetings, it would not be possible without the masterful orchestration of Laura Blankenship. Laura, if you could stand up, please wave. When Bernadette was talking about dedicated change management resources, we recognize that everyone has day jobs, and we were able to trick Laura into volunteering, and so I wanted to thank her for doing that, and to thank you all for making the time to be here. We hope to see you all again in future meetings, future sessions, and if you have any questions, please don't hesitate to reach out to me or anyone else on the team. Thank you all for being here.